Andhra Pradesh allopathic private medical care establishments rules and regulations appendix 1 2. The establishments offering diagnostic support. The diagnostic services are offered by various laboratories. 1. Clinical biochemistry labs and pathology labs, hematology labs, microbiology and serology labs, histopathology labs and cryopathology labs, cytogenetics labs, immunology labs, radioimmunoassay labs, radiology and imaging services. 1. Clinical laboratories. The laboratories may be comprehensive, performing tests related to several laboratory disciplines such as clinical biochemistry, clinical pathology, microbiology and serology, histopathology, say anatomical pathology, hematology, cytopathology, cytogenetics, immunology, or may be limited its scope to a few disciplines. The type and extent of laboratory facility to be available for a nursing home would depend on the functional programming of the nursing home, but provisions shall be made for the following minimum procedures to be performed on site or at a nearby facility: blood counts, urine analysis, blood glucose, blood urea and nitrogen, coagulation profile, that is bleeding time, clotting time, prothrombin time, blood grouping, typing and cross matching, serum electrolytes, serum amylase. The physical requirements, including the space, equipment, and manpower needed for these facilities, depending on the bed strength of the hospital, are given in the Part 2. 2. Radiology and imaging centers. The radiology and imaging centers may be comprehensive, performing tests related to X-ray imaging, ultrasound imaging, computer tomography, magnetic resonance imaging, etc., or may be limited its scope to a few disciplines. Equipment and space for these centers would have to be planned according to the equipment services planned in the minimum. Following X-rays should be possible: X-ray chest, abdomen, pelvis in the basic X-ray units. In big centers attached to any hospital providing emergency surgical facilities, the X-ray machine should be installed within the nursing home premises. In small facilities, it should be possible to have access to such X-ray facilities within 1 hour. Portable ECG facilities should be available in all nursing homes round the clock. The ultrasound scanning facilities are also may be comprehensive, providing services in color Doppler imaging, basic abdominal scanning facilities, and obstetrics scanning facilities, and in some centers may offer ultrasound guided biopsy of the tumors for cytology testing. Part 2. General requirements. Most of the private medical care establishments located in the state are general hospitals or nursing homes set up to deal with the full range of medical conditions most people require treatment for. But there are other hospitals specialized in a particular disease or condition, such as uh, heart care, cancer care, orthopedic care, ENT care, ophthalmic care, etc., or in one type of patient, that is women, children, the elderly, etc. The specialized hospitals provide latest specialized treatments for every disorder in the concerned specialized area. The service mix of various hospitals is given at Part 6. This is Part 2. A. Functional program. The hospital and nursing home should have the following functional areas, namely: outpatient department with general waiting and reception areas and clinics for each specialty care services offered with required equipment and furniture, wards for general inpatients and individual rooms for the patients with necessary ancillaries, fully equipped operation theaters for the type of specialty service delivered, central sanitization and supply department, blood bank, accident and emergency department, that is casualty, pathology department, radiology department, laundry unit, hospital store, medical records department, workshop and engineering services and transport services, mortuary and community services. As per the physical standards, certain basic facilities need to be provided by the hospital irrespective of the services being offered, such as emergency first aid, such as 1. Emergency first aid. Emergency first aid is care provided initially to stabilize victims' conditions and to minimize potential for further injury during transport to an appropriate service. At minimum, each nursing home shall have provisions for emergency first aid treatment for staff as well as for persons who may be unaware of or unable to immediately reach services in other facilities. This is not only for minor incidents that may require minimal care, but also for persons with severe injuries or in grave condition who must receive immediate first aid and assistance for transport to other facilities. Emergency first aid includes facilities for intubating, weaning pot, thorough cleaning or dressing of wounds, ligations of bleeding vessels, insertion of intercostal drainage tube, application of Thomas traction, starting of nasal oxygen, bladder catheterization, stomach wash, establishing an intravenous line in case of patients in shock, controlling of convulsions, controlling of the acute attacks of breathlessness, etc. 2. General medical care services. The medical care services do not require any special infrastructural input. It is mainly a question of medical skill, and hence medical patients are normally admitted to hospitals or nursing homes which provide care in other disciplines. All hospitals or nursing homes providing medical facilities should be able to provide clinical diagnosis for infectious diseases, diabetes, hypertension, autoimmune disorders, etc. Treatment and follow-up care for a majority of these conditions would also be possible by a physician. Medical personnel manning such a facility should be able to take a decision regarding cases which require higher medical skills or which may eventually need transfer to a better equipped facility, that is intensive care surgical facility with ventilators, hemodialysis machine, cardiac monitors, etc., and accordingly transfer such patients at the earliest. 3. General surgery services. A general surgery care facility should be able to provide elective general surgery services but benign anal conditions, inguinal hernia, hydrocele, varicose veins, testicular tumors and abscesses, vasectomy and splenectomy, elective surgery for uncomplicated urolithiasis, gallbladder conditions, and closer detection of fractures can be performed. If portable X-ray facilities is available, the emergency care for cases of acute abdomen, strangulated hernia, torsion testis, etc. can be provided, subject to condition that the facility have X-ray facilities within the hospital and access to the blood bank and ultrasonography facilities are available within half an hour. Pathology. There should be provisions in hospitals or nearby locations for minimum pathological tests to be performed on site or at a nearby facility. Power supply. For the running of a hospital, the availability of a power supply is of utmost importance. Those with non-availability of continuous power supply, a generator should be available. Water. 6. Water. The hospital should make arrangements for drinking water for regular usage either from the municipal or Gram Panchayat authority and should have storage facility either underground or in an overhead tank. 7. Transportation and communication facilities. Communication and transport facilities should be a prerequisite for the functioning of a hospital as the time for providing any intervention is often critical. It should be the responsibility of the hospital to provide proper transportation facilities to the patients, especially when they are referred by the hospitals. The hospital should have the facility of a telephone in case of an emergency and to have a communication between the doctor and supportive services and with the patients. 8. Firefighting. Firefighting equipment should be available as per the requirements of the building spaces. 9. Facilities and space. A hospital should have certain basic facilities in terms of various zones for the provision of treatment. These are the waiting room, the dispensary or pharmacy center, dispensary or pharmacy counter, bathrooms, consulting room, dispensary or pharmacy counter, toilets, bathrooms, wards, among others. Those providing surgical services and maternity services should have a operation theater, labor room, sterilization room, changing room, etc. 10. The waiting room. The waiting and consultant room are the first entry points of a patient visiting the hospital. Certain basic facilities needed to be provided for the comfort of a patient during his waiting. The environment of the waiting room should be such that it is pleasing and non-congested. Various types of information needed to be provided. The doctor's qualification, registration in the council, and the schedule of fees should be displayed in the waiting room prominently. There should be a proper system of entry to the doctor's chambers. Enough space should be provided for the patients and their relatives to sit in the waiting room.